Hey, welcome to Tuesday Talks. We're going to shift gears. We're going to have a series on what to expect postoperatively. And this first talk is going to be what to expect postoperatively following a tummy tuck. Okay. One of the most common questions I get is, when can I return to work? Well, for tummy tuck patients, I tell them it's possible you can get back to work in 2 weeks if you have a light duty desk type of job. It does not mean you're going to be perfectly healed and feel great. You're still going to have issues with your energy levels going to be a little bit low, or your energy reserve is going to be a little bit low. Other questions we get is, when can I return to normal activity, or what restrictions do I have? So for tummy tuck, particularly for tightening the muscles, you're going to have 6 weeks where you're going to have no heavy lifting, no strenuous activity, and by heavy lifting, I mean nothing more than, say, 15 pounds, which may be important because a lot of patients who have tummy tucks have young children they have to take care of. Okay, the other questions we commonly get is, how do we take care of drains? Well, I don't use drains. There's no need, in my opinion, to use drains because the drains have a function, but we can overcome that function of the drains by using a progressive tension suturing technique, and that eliminates the use of the drains and the hassle of the drains, because patients are uncomfortable with the drains, particularly if they stay beyond a week and a half or 2 weeks and 3 weeks. Those drains become uncomfortable. Anytime you move, they'll pull, they'll tug, and patients really don't like drains, and we don't need them. So that's a really one of the great benefits in having a tummy tuck done here, because we do drainless tummy tucks. Okay. Then we get questions, how do we take care of the incisions or the dressings? For me, and again, every plastic surgeon is going to be different. The only dressing I have the patients change once, maybe twice a day, is the dressing inside the belly button. So it's a pretty simple, straightforward dressing. The main incision, I don't have them dress or change anything until I see them back in the office. Okay. Now, what to expect after surgery? Okay, for the first 48 hours to 72 hours, your swelling starts to increase. And your pain follows it, and you're going to peak in 48 to 72 hours, and then you're going to kind of plateau. So expect that your swelling, if you have your surgery on Monday, you'll notice some swelling on Tuesday. It will be even worse on Wednesday, and your pain will follow that. Now, what I like to use is a drug called Exparel. It's a long-acting numbing medicine. It lasts for 48 to 72 hours. So what it does is, it doesn't make your surgery pain-free, but it takes away how high that peak pain is going to go, so it kind of flattens out that curve. Okay. Now, the other thing we talk to patients is, in our practice, a patient who has a tummy tuck is going to stay overnight. So we have, at a minimum, 1-to-1 nursing care. More times than not, you have 2 recovery room nurses taking care of 1 patient. So you get very good high-level care, and then you go home early the next morning. Because of the tummy tuck draws your skin very tightly, you won't be able to stand up straight after surgery. So most patients are bent forward. When they walk, it's real slow and they're bent forward. And over time, over the course of maybe a week or so, you can start to stand up straight. Now, what you'll notice is, because you're bent forward, that puts a little pressure on your low back, or a little discomfort. So it's not unusual to have discomfort in your lower part of your back. As you become more and more vertical, the back pain tends to go up higher and higher on the back, and that's all fairly normal. So there are a lot of other things we can talk about, but those are probably the most common questions I get about the postoperative stage of a tummy tuck. We, of course, are going to